Okay, there it goes. Hi, everyone. Welcome to today's presentation. I know it says Mackenzie Jones, but this is Dr. Amy. She owns Pelvic Prescription in town. It's actually off of Oleander, and she has helped lots of not only women and men really help with their pelvic floor. She's a physical therapist that specializes in that. And so I know you are probably thinking, pelvic floor is more like childbirth or after childbirth, which they've supported me in that, and it was amazing. And I don't think I'd be where I knew I wouldn't be where I am today without them after having a baby. But it doesn't even have to be that. It could be, just urinary urgency, frequency, pelvic pain. I'm sure she'll go into all this, but anything you're struggling with and just like you have tension in your pelvic floor, they're going to really help with the deep breathing. I know that was like the best for me, in exercises. And it doesn't have to be like I have to go in and get a pelvic exam like right away. Like everyone gets really scared of that. And so they're going to meet you where you're at. And so I love them for that. They are just a great voice in the community. And I'm so thankful met Dr. Amy a few years ago, and so thankful for her and thankful that she's here today. So I'll let her take it away, and let us know if you have any questions.
Awesome. Thank you, Mackenzie, for a wonderful introduction. Today, we'll be talking about under pressure, so how stress affects your pelvic floor. And I'm going to share my screen so you guys can see the presentation as well. Okay.
Yep, looks good.
Okay, perfect. So I already got an introduction, but just to reintroduce myself, my name is Dr. Amy Newberry. I'm the owner of Pelvic Prescription Physical Therapy and Wellness. And as Mackenzie said, my background is physical therapist. So I went to PT school and then did additional training for pelvic floor health. And Mackenzie hit it right on the nail with pelvic health includes both women and men, and it's not just during pregnancy, postpartum. We help women and men throughout any age, and sometimes even pediatrics. We personally don't do peds, but there are a lot of pelvic floor therapists that do. So we'll dive and get right into it. And the reason why we are talking about this particular topic is because in pelvic floor therapy, one of the major drivers that we see that affects the pelvic floor is stress. And we'll be talking a lot about like why that is and how it happens and what to do about it. Okay. So here I put a little image of the fight or flight response. Some of you might have heard of this. Some of you, maybe it's the first time, but we have our nervous system, and it's broken up into the sympathetic and the parasympathetic system. So the sympathetic is that fight or flight that you might hear. It's like what activates if you are worried about a threat, like you're being chased by a bear. Your body puts you into this state where it's going to protect you. And these are all the different things that happen to our bodies when we're in the sympathetic or fight or flight response. And then before we dive into that, the other one is the parasympathetic nervous system. And that is where we call it like your rest and digest. That is what is activated when we are calm and we're not being chased by that bear, and our body has a chance to that's when you do like your digestion is optimized, and that's when you are able to empty and go to the bathroom and not be under a lot of like physical stress. So we'll talk a little bit about the parasympathetic side a little later, but going back to the fight or flight, as you can see here, there's different things that happen. So like an example is your eyes. You get tunnel vision, so your eyes like constrict. A lot of blood is being pushed to like your heart and your muscles because you're trying to like go. But it does slow blood to like the digestion system, and your bladder relaxes, which that sounds counterintuitive to hear that the bladder relaxes. But what that means is that the muscles of your bladder, when you go to the bathroom, they actually contract. And so that's why bladder relaxation means that your bladder is not trying to empty when you're under fight or flight response. So the part that we're really going to focus on is going to be the muscles. So what happens to the muscles when we're under fight or flight? They tense up, and they do that so that it can really get you going so you can run and get away from that bear. The other thing to note is that when we're in fight or flight, our breathing changes. And this is really important because a lot of what we do in pelvic floor therapy, especially in the beginning phases, is learning how to control your breath work and using that to help your nervous system to calm down and also to help your pelvic floor muscles learn to be retrained. So if you're running from a bear, you're probably going to breathe like like really shallow, really fast. Or maybe if you're sitting on Market Street in the middle of traffic, you might also be like, getting really frustrated. So how do we stop that? um, and another thing to think about is when our bodies are going into this like urgent feeling of needing to react really quickly. There is we'll get into what happens to the pelvic floor, but all these changes affect you in the short term, but we'll also talk about what happens in the long term when these things start to stack on each other and they're not addressed. Okay, so don't forget that, remember that. And now we're going to talk about pelvic floor muscles. And so these are the group of muscles that are at the base of your pelvis. This is from like a bottom view here. And I have both female and male anatomy just to make sure that everybody knows that guys have pelvic floors too. Sometimes we hear people say like, oh, well, men don't have pelvic floors, so why do they need to go to therapy? But there's a huge group of men that are also suffering in silence with the same issues that women are experiencing. So these group of muscles, they are responsible for 5 major things. The first thing is support. So you can think about the muscles as like a trampoline at the base of your pelvis. And if you think about a trampoline is it's able to kind of spring up and also go down. And so you can kind of imagine, the last time you were maybe jumping on a trampoline and how when you jump up, it goes up. And then when you land down, it does extend down. And so our pelvic floors are really dynamic, just like a trampoline is. And you can also think about your pelvic floor like your arm, like your bicep muscle here. So when you engage your pelvic floor, whether it's on purpose or your body just does it automatically, those muscles contract and they shorten. And that's the trampoline moving up. And then on the flip side, when your pelvic floor starts to relax or even lengthen, it's kind of like your bicep opening. And that would be like the bottom part of the trampoline when it's descending. Now, we run into a lot of issues when the muscles aren't functioning correctly. So remember how I said when we are in our fight or flight response system, how the muscles tense up? So the pelvic floor also tenses up. And so instead of the pelvic floor acting like a trampoline, it ends up being stuck in this like up here phase. And so with the bicep analogy, it's stuck like here. And when it's stuck, then it can't do its 5 functions, which is 1, support. So support of your organs. You have bladder, you have sexual health organs, and then you also have your bowels. And if the muscles are too tense, then that's when you'll see issues like leakage, pelvic organ prolapse, rectal prolapse, those types of conditions. Now, one of the other functions of the pelvic floor is stability. So stability of the pelvis girdle, which is just the right side of the pelvis, and the sacrum in the back side. And when you don't have that stability, and a lot of our pregnant patients, they'll come in and complain of pain. And a lot of times it's because there's so many changes going on in the pelvis that they're losing some of that stability. So when your pelvic floor isn't doing its job and it's stuck here, then you're going to lose stability. And that usually results in pelvic pain, back pain, and hip pain are some of the major 3 things. The other function is sphincter control. So I did mention leakage. So making sure that when you want to go to the bathroom, whether it's urinating or emptying your bowels, that you are able to empty, but then also that you don't empty when you don't want to. For example, when you're jumping on a trampoline or when you're walking through the supermarket. Last two functions is sexual function, so making sure that the muscles are not too tense, because if the muscles are too tense, then a lot of times our patients will complain of pain with intercourse or pain with orgasm, and that tension in the muscle will cause those types of issues. The last one is sump pump control. So a lot of fluid can accumulate in your pelvis, especially postpartum. And so your pelvic floor, its job is to help pump fluid, lymphatic fluid, and blood, back up to your heart in your body. So those are the 5 functions of the pelvic floor.
Amy, this might be a hard question, but do you see like hernias? Is that like a weakened pelvic floor? Is that like inguinal hernias, anything like that? I wasn't sure.
Yeah, we see hernias a lot, like umbilical, inguinal, and that there could be a tie to a weak or tight pelvic floor,
Okay.
especially if the tension in the pelvic floor is so great that it's causing the pressure to go out through the abdomen.
Mm,
There's a weak spot in the abdominals is something that we'll see.
okay, cool. Thanks.
Yeah, you're welcome. Okay. So here's that bear. I wanted to share a super interesting piece of research that was published initially, I think in 1999, and there's been some updated studies, but they put some, it's called surface EMG. So that measures muscle activity, and you just push it. You would place it like a little electrode on whatever muscle you're trying to measure. So there was a study that put these electrodes on the pelvic floor muscles and on the upper trap muscles. And the research participants, they were shown different clips of like threatening images, like for example, being chased by a bear, situations that were dangerous. And what they found was that when the videos or images were placed in front of the participants, the pelvic floor actually activated first before any other muscle group, including like the upper traps. So I think that's super interesting, just to show that your pelvic floor does react to a visual stimulus that could be threatening. And it happens because your body is trying to protect you. So I just feel like that's really important to point out, because yeah, that happens in a moment, but imagine if you are somebody who has experienced a threat or some kind of trauma, and that constant stress or trauma or experience is, it's constantly there and you're never able to come down from it. The concern there is that you're going to be in a constant state of stress, and your body is going to be constantly tense, including your pelvic floor, which can lead to all the pelvic floor conditions that we'll talk about in a couple of more slides. And it could be even emotional trauma. It doesn't even have to be a physical trauma. There are also studies that show that people with pelvic floor pain have higher rates of anxiety, depression, and a trauma history. So there is a big connection here, even if you didn't specifically have like a pelvic floor injury per se.
I love how you talk about the bear. I tell that to everyone too. I'm like, primitively, that's what our body thinks. We're being chased by a bear. Really, it's your job or your husband or whatever.
Yes, exactly. Nowadays, it's not quite a bear, but okay, so here are some symptoms that you might experience if your pelvic floor isn't functioning the way that it should be functioning. I broke it up into 4 categories. So urinary, bowel, pelvic pain, and then other. So urinary, you might have urgency. So that's like feeling like you have to pee every 30 minutes. The typical amount of time that you should be able to wait is every 2 to 4 hours. And that ends up being about 5 to 7 times a day during the daytime. Another kind of condition that you might see is leakage. So when urine leaks out when you don't want it to, that could be either related to some kind of impact or stress incontinence, or urge incontinence, which is when you have a trigger that makes your bladder empty. There's urinary frequency, which we touched on. If you're, going to the bathroom more than 5 to 7 times during the day. Another urinary condition would be like hesitancy, so you're not able to empty your bladder all the way. And then interstitial cystitis, which is bladder pain syndrome, and that's more of a chronic condition that requires a multi-disciplinary kind of care there. On the bowel side, you'll see constipation, fissures, hemorrhoids, and fecal leakage. And so those are all conditions that we treat as well. So one side of it is constipation, like you're not able to empty, and constipation is super, super complex. There's so many things that can contribute to it. On the pelvic PT side, we're really focusing on the mechanics. So we'll see like, hey, is your pelvic floor tense? Because if it's tense, then it's going to be really hard for your bowels to empty past the anal sphincter. The other thing we'll look at is sometimes when people are trying to push their poop out, they end up constricting their pelvic floor more, and that will prevent someone from being able to empty as well. Now, on the pain side of things, we have pelvic pain. So that would be like pain with sex, using tampons, or pain with a pap smear exam, pain with the perineum, the spelling error there, pain in the vaginal area, rectum, penis, testicles. Those are all areas that we can treat. And then the last category is other pain. So that's more like orthopedic pain that we'll see. So tailbone pain, pubic pain, back, SI joint, hip pain. And sometimes I always tell like our orthopedic PT friends, if they are treating somebody with like back pain or hip pain and it's not really getting a ton better, maybe a little bit, send them over to pelvic PT and we can check their pelvic floor to see if the pelvic floor is actually the root cause or the root driver of the back and hip pain. Okay, so I was going to share just a little example of a patient I worked with a couple of years ago. I'm going to share a little bit of like what we kind of found on exam and what we did for treatment and some of her responses to the exam or in the treatment process, because it's important to note that the pelvic floor for this particular patient was holding on to a lot of stress and emotion, and sometimes that does come out during pelvic floor therapy treatment. So this particular patient that I had, she had a lot of hip pain and pelvic pain. And on exam, we found that she had a very like overactive pelvic floor, and also her glutes were very overactive. And by overactive, I just mean that, when you're thinking about the bicep analogy, her muscles were stuck in this like tense state. Now, she was like really active in yoga, but she definitely had some trouble with her diaphragm, which is the primary breathing muscle. It was very like restricted as well. And so some things that we worked on during treatment was external hands-on care to the hips and the glutes that were overactive. And then we did some external work to her diaphragm. And then we also did internal pelvic floor therapy with her. And one of the interesting reactions that she had was sometimes during, hands-on manual therapy, we might get to like a trigger point or a tender spot, and a patient might experience an emotional response like crying. And this particular patient experienced coughing, which was like really unique. And that was the first time I ever had that happen. And there was one spot in her pelvic floor that produced the coughing. And so over time, we like worked on that one spot over several weeks until at the end of her treatment, that spot no longer elicited the coughing response.
Is that from the diaphragm, I guess?
I saw it more as like a
Release.
like a vagus nerve, something like, I don't exactly know.
Interesting.
But, yeah, it was very interesting. I was like, this has never happened before. There's some other treatment strategies that we worked on was breath work and exercises for calming her nervous system, and obviously getting like mental health therapy on board too for the response. And in this particular patient's example, sometimes I'll hear people people will say, hey, just do Kegels for XYZ. It'll fix the problem. For this particular person, Kegels would have definitely made it worse. So that is something to be very cautious of and advised to be weary of taking without a full pelvic floor assessment. So yeah, the biggest thing is, our goal is to reduce the symptoms, because when it's tied to the nervous system and having to regulate it, it takes a long time sometimes. And also we're having to retrain the body to feel safe again. Okay, so this is a little cycle that we see often in pelvic floor therapy. So there might be, and the reason why I'm bringing this up is because it's why is this happening, and why is it happening for so long for some people who are experiencing chronic pain? So typically there is an injury, whether it's traumatic or not. It might not be. It could be just a lot of things happen to you in your life at a certain point in time. Or you could have fallen on your tailbone or had a birth injury, either or. Then when you have that injury, you start to experience pain or symptoms. And I say or symptoms because maybe it's not pain, maybe it's leakage, for example. And then when you start to experience that pain or the symptoms, that creates more stress because you're like, why is this happening to me? This really hurts, or this is really frustrating. And then once that happens, your muscles respond in tension. That constant concern and worry, frustration and pain causes the muscles to tense up even more because it's trying to protect you from whatever is happening. And then that tension actually causes more pain and more symptoms. So then you end up in this cycle of this pain cycle or symptom cycle if it's not necessarily pain. Now the question is, why does this happen? So here's a little example. Sometimes I'll show people to understand, especially when someone's wondering, why is this happening to me right now? And this is an example just to show how all these little things in your life could change when you have a symptom occur. So the dotted line is a pain or symptom threshold. And when you're above that threshold, that is when you start to experience pain or see symptoms. So this particular made up person, you can see the first dot is when they fell on their tailbone when I was 5. And sometimes that's something that people forget about. But then that, kind of shoots them up. Well, they were here and that brought them up here. And then maybe when they were in middle and high school, they started doing gymnastics. And I bring up gymnastics because often we'll see a lot of pelvic floor overactivity in middle and high school female athletes. There's so much pressure and tension on their pelvic floor, so that bumps them up a little bit. But let's say they stopped doing gymnastics in college, kind of came back down, and they're back down here. And let's say they graduated, got a stressful job, and all of a sudden they're back up here. And then let's say they started yoga regularly and started managing their nervous system and doing breath work, and that kind of brings them down here. And let's say they get into a car accident and all of a sudden they're past the symptom threshold, but they were already here versus starting down here. So it just kind of shows that. And I picked the last one kind of as a traumatic experience, but it might not be that. It could be some trauma, it could be an accumulation of poor nutrition, poor sleep quality, because sleep is when your body is repairing. Could be a birth-related injury, a breakup or a divorce, depression and anxiety, or a life transition or change. So it could be anything. And so we try to help our patients understand where, all the different factors that might have gotten them to this point where they started having pain and symptoms, and one at a time addressing each of the things. Okay, so we got to break the cycle. We have that little circle, and it's okay, I'm in the circle. How do I get out of it? And so our job is to help break that cycle. And one of the first things that we teach on visit 1 with our patients is breath work. Now there's different, you can go online on Google, ask ChatGPT, go on YouTube and find all sorts of different ways to incorporate breath work. One of the ways that we always start with is diaphragm breathing, which is basically, it means that you're not breathing with your chest. So chest breathing is really shallow. And if you take a big, deep breath, you're and your chest rises, versus diaphragm breathing is a little bit lower, and your diaphragm, it's shaped like a little dome at the base of your rib cage. And when you breathe in, it actually contracts and it flattens. And then when you exhale, it comes back up. So when you inhale, it expands, comes down, and then when you exhale, it just goes back up. And the reason why the diaphragm is so helpful is, one, it helps activate your vagus nerve, which goes through the diaphragm. And your vagus nerve activates that parasympathetic nervous system that we were talking about at the very beginning of the presentation. And the more that you can activate that parasympathetic nervous system, the more that you'll get out of that cycle, or the chances are higher. Now, I do have some patients who don't respond great to normal diaphragm breathing, and that's when you have to get a little creative. So there's like 360 breathing, there's box breathing, which I find really helpful when somebody is not responding to diaphragm breathing. And that just means like you breathe in for a 3 or 4 second breath, and then you hold it for 3 or 4 seconds, and then you exhale for 3 or 4 seconds, and then you hold it, and you kind of go in that box format. So I think if you're experiencing any sort of stress or tension, or you suspect that this might be where you're at, this is a great place to start. And then if you have any trouble, you can always find people to help you with guiding you through breath work. This is very, very big and popular now, so it should be easy to find help. Oh, and the piece of it, besides just helping activate your parasympathetic nervous system, your diaphragm and your pelvic floor have a very close connection too. So I mentioned how the diaphragm is shaped like that, like a dome. And then I mentioned how your pelvic floor is shaped like a bowl. So they actually look like this on each other. And when you diaphragm breathe and your diaphragm comes down, it actually allows your pelvic floor to open and lengthen. And so if you are experiencing an overactive pelvic floor and having all these symptoms, diaphragm breathing will start to get your pelvic floor back to a more normal function of being able to lengthen and contract through a full range of motion versus being stuck up here. And that, coupled with pelvic floor therapy, like the internal and external work together, makes a huge difference.
Yeah, no, everyone gets mad at me preaching about breathing, but is there anything like you tell people just try to like book in their day, like when to get it in? 'Cause I think that's the hard part when you're in that cycle. Your brain doesn't think like, oh, I should go breathe. I feel like that's always the battle of like, when do you do these things?
No, I feel like it's so hard for even just like, I'm probably, what you probably see this too, Mackenzie, but it's so hard with like therapy. Like, when are you going to do it? Because we are asking for sometimes a lot. I always share that, try to pair it with something that you do every day. So whether it's like at this certain red light on the way to work, or if that's not consistent enough because maybe it's green, maybe it's like when you're making coffee, or maybe when you are brushing your teeth, like trying to pair it with some sort of activity that is already in your daily rhythm that can help at least.
Good idea.
Yeah,
and then go to therapy, right? Because then you're getting more into
yes, go to therapy. And then we talked about vagus nerve a little bit already, but it got its own little slide because it's that important. There are so many ways to activate your vagus nerve to really calm your nervous system down and downregulate it. These are just a couple of ways that you could do it: going on a nature walk outside, doing restorative or yin yoga, humming, singing, gargling, which is, I think that's always so funny, cold exposure, social connections, and then managing your gut health, right? That's not for us, so we refer for that. But these are just different ways to address the vagus nerve. Okay, so also nervous system, this is all very connected. You can go on YouTube and find different like body scans and progressive muscle relaxation exercises, and it'll just guide you through like scrunch your toes and let them go. like scrunch your face and let it go. And there is something to like squeezing the muscle and letting it go consciously that helps your body start to actually relax. So I always love doing some sort of body scan or progressive muscle relaxation technique. And then you can also do different like stretches, which will put us into the next thing, which is pelvic floor health. So in pelvic floor therapy, we do a lot of different things. And I know Mackenzie had mentioned that sometimes people do get nervous when they think about pelvic floor therapy because you're like, ooh, like, what are they going to do? What's going to happen? Are they going to check, like, are they going to do a vaginal exam? And the answer is yes, we are trained to do that. But if you're not comfortable with that for any reason, you don't have to start there. We can always start somewhere else, and we'd never have to do that until you are ready for that, if ever. And we even see people through telehealth, like virtually, and are able to treat people with just the same outcomes that people get in person. So while the exam is super helpful, it's not the end all be all. We can manipulate and change the pelvic floor, even just with stretches and exercises, the breath work, a lot of behavioral, like lifestyle changes, also really important pelvic floor therapy. And then, of course, the actual hands-on part of it, which is going to be like the external work and the internal work, if you're okay with that.
And that's what helped me, I feel, the most was just the cues of like how to activate your core and like, are you holding tension in your pelvic floor? Like just those things I felt like were even, more helpful than, just all the internal external work.
Mm-hmm. Yeah, there's so much more to it.
Yeah.
I mean,
Yeah.
I always say it's way more than Kegels because we'll
Yep.
definitely get the phone call and they're
I
like,
don't
well,
need Kegels.
yeah,
Right?
yeah. If you're watching this and you're connecting with this presentation, you probably don't need
Don't need
Kegels.
Kegels. The opposite.
Don't do that. Because if you think about what a Kegel does is if your muscles are already here and if you're trying to Kegel, you're trying to like get a little bit more, but there's no space and you can't get a good contraction if you're already tense. So our focus is lengthening those muscles so that they can have that full range of motion. And if they have that full range of motion, they can do those 5 jobs that we talked about earlier. Okay, so this is a little bit more in depth about pelvic floor therapy. So as we talked about, you have the exam. Typically that's day 1. So you'll have the external, internal, if you're okay with it, looking at alignment, posture, ribs, diaphragm. And the external includes like glutes and hips and all of those good things. Now, when it comes to actual treatment, it's looking at the manual therapy. So that might look like myofascial release, trigger point release, visceral work, cupping, dry needling. And then you have retraining muscles. So once your muscles have achieved that full range of motion that we were just talking about, then it's time to get the muscles strong again. And that's why I'm always cautious about the whole Kegel thing, because we have to make sure you have that full range of motion. And then we start retraining everything from your pelvic floor, your glutes, your abdominals, and looking at any muscle imbalances. And then, of course, the nervous system that we've been talking about this entire 45 minutes is the individual strategies for different people, because some things might work for one person, but it's just not going to work for another, especially for our busy moms who have very, very little time to do things. Activating the vagus nerve and the rest and digest system. Okay, so here are just some fun pictures, just so that you people can get a better idea of like what it might look like. There's a lot of education, so you can see over here, everything is explained very clearly so that there's no piece of it that is questionable, and then external assessment, and then internal assessment. And then here's more of the exercise part. So, rebuilding that foundation and trying to reactivate those muscles all the way to functional things like being able to, lift and carry your baby as they grow. Being able to lift a heavy suitcase above into the little airplane cubby thing. I had a lovely male patient a few years ago. His goal was to be able to help another person on the plane be able to put their luggage up there if he wanted to. And just so sweet. And then functional things like exercise too, being able to help women and men get back to exercise without leakage and without pain. And then it's not in your head, and just relax doesn't cut it. Sometimes we'll have patients come in and just share some like heartbreaking stories about how how other providers maybe like didn't believe them or sort of like wrote them off and didn't really take them seriously. Or maybe they said, I hear this one a lot where they say, oh, just have a glass of wine and then sex won't be painful. Just relax. But this is just to tell you that it's not in your head, and just relax isn't going to cut it. It does require treatment and therapy and guidance. So major takeaways is, stress. I feel like stress is something that all of us experience like on a daily basis at this point. And this is just to say that stress doesn't just mess with your mind, but it also affects your physical body. And I'm sure many of us have had multiple experiences like where that's happened. And so just remember that stress affects so many things, and it's so important to prioritize stress management because it will not only help your mental health, but also like your physical body. And things like overactivity of the pelvic floor, pain, urgency, constipation, all those can be signs that stress or some kind of injury is affecting your pelvic floor, and that there is help out there and people like us who are trained in guiding you through that process so that you feel supported every step of the way and you feel heard and listened to and supported. And it's a whole team approach with collaboration between like functional medicine, like nutrition, obviously us with pelvic floor therapy, mental health therapy. It's not always just a one thing will be your answer. It's definitely needs to be a multi provider approach for the best results. And just resources. So here's a couple of apps that I really like Calm, and then YouTube. You can go on YouTube and type in like progressive muscle relaxation. A book that's really good is The Body Keeps the Score. I feel like a lot of people have heard of that one. It's a thick one. A great book for like sexual health and wellness, especially if you're experiencing any pain or discomfort with that, is Come As You Are. And then our Instagram is also a great resource for like quick tips. And that's our handle. It's at pelvic.prescription. And then our YouTube has a little bit more in-depth videos versus Instagram is just like quick facts to go. And then that QR code, I had to double check it because I couldn't remember, but it goes to our website.
Nice. Well, thank you. Yeah, I was like, I love y'all's Instagram. That's very helpful and good reminders.
Mm-hmm. Yeah, thank you.
Thank you.
Yeah.
Awesome. Thanks, Amy. Yeah, I feel like in our practice, I feel like I'm hitting people over the head with this. Like, we got to work on stress management. We got to work on breathing. And it really is just all so connected. And I wish if I had gone back on, not that it is what it is, but on my health journey, I wish someone would have said like, hey, like, let's talk about your stress management and your nervous system. And like, that's why I felt like it was such a journey and like clawing my way out to, to get where I am today, because I didn't really work on, deep breathing and this stuff first. And so that's why I feel like we're such advocates for it, because we see all the ramifications of not managing stress. And I think, everyone we see probably just has high levels of stress, and we need to have good things into place to be able to manage that.
Yeah, like I'm speaking to myself here too.
Yeah, exactly. Yeah, you're like, oh yeah, I should do that.
Yes, yes.
Yeah, like I'm holding my pelvic floor right now.
Well, yes, when I'm driving, I find myself, and once you have a good connection with your pelvic floor, you'll be like driving or doing whatever, and you're like, oh, I'm tensing. I need to like let it go.
Right. And I'll say too, like even soon to be mamas or postpartum mamas, I felt like, a lot of education, I got supported because of you guys, but I feel like there's no support in like, how do you push and like postpartum recovery and what's that look like? So I feel like you guys do like a really good job on that. But like you said too, it doesn't have to be, it could be a male too. I was thinking of a male patient who has a hernia, and I was like, oh, I wonder if they should come see you. Like probably.
Yeah, yeah. And yeah, I loved what you said about, yeah, the hernia question was great because that's a little outside of the pelvic floor, but definitely related. And then with pregnancy and like birth prep, that's a huge part of like our vision. In our vision statement is to create like proactive and like preventative care. And so birth prep is more on the proactive and preventative side, because we're trying to get people ready and to reduce their risk of any like postpartum sort of injuries. And
Yeah.
I feel like in the past 3 years, I've seen a major shift of more and more women coming in prenatally before they have any issues and getting the support that they need ahead of time. And their postpartum journey looks, I mean, so different than the people that like didn't know about it prenatal and they had just come postpartum.
Right.
There's definitely a huge
That was
difference.
definitely me. Yeah, I was like, I feel supported and I know what to expect kind of, and it was like smooth sailing for the most part. Yeah. So yeah, thankful for you guys. If you guys have any questions, feel free to I'll post this on the community, and there's a spot for questions, so I'll send it to Dr. Amy if you guys have anything. And then I think you guys do a discovery call, right, Amy, if you are
Yeah.
interested.
For anybody that is interested, if you go to our website, you can book a call with us, and then we'll kind of talk through like our treatment approach depending on which condition that you're struggling with, and it's very specific to each condition. So we'll talk you through that.
Okay, awesome. Yay. So yeah, we'll highly recommend them. And I'm sure I feel like everyone could use pelvic floor therapy for the most part. I mean, everyone probably holds attention to their pelvic floor and,
Yeah.
just preventive, further along the line. So, well, we appreciate you and thank you so much for doing this. We appreciate you. Oh, you know what? I gotta hold on. I'm like jumping off and I gotta do this really quick. All right, let me share next month. Okay, so in June, I'm like, I can't believe it's June. What the heck? It's like almost June. It's going so fast. So I'm going to talk about metabolic health, some more of like nutrition, diet, insulin sensitivity. I share with a lot of you, like everyone wants to fix their sex hormones first, and I try to do more of a root cause approach, which is insulin, then cortisol, then thyroid, then sex hormones. And we can always of course focus on hormones, but I find we're kind of chasing our tail if we don't get to those three things below in the pyramid and working our way up. So we'll talk about insulin resistance, becoming metabolically flexible, and then our mitochondria, which gives us energy. And as we age, those decrease, and we want to, of course, be proactive. And so I'll talk about some tips and tricks we can do with that. And yeah, I'll see you guys there. So let me stop sharing. And okay.